EAO is all about moving science forward together. And obviously, good clinical practice is always evidence-based. However, getting good qualitative and quantitative research is often difficult because of sample sizes which are too small or advancing new techniques which go way too fast. That's why EAO organizes the consensus conferences, where a group of researchers and professionals get together to discuss what they see in literature and what the consensus for the industry means. And in this episode, we're going to zoom in on the biological aspects that were discovered at this consensus conferences in February 2018. And therefore, I'm joined by Alberto Salgado from the University of Alicante in Spain. And you're one of the contributors to the digest of this conference, right?
Yeah.
Well, Alberto, welcome. The key outcome of this conference is this big 300-pager, right? This big book, all the scientific proof and readings is there. But we can imagine people are very busy and they don't have time to read that all. So what have you produced?
Well, I think it's not only a question of time. It's a question that we want to bring the gap between the science and the general dentist, because we want to make this information available for every single dentist. So in this case, what we are doing with the digest is like making the same that we are doing in the consensus report, but a summary and in an easy language that any one of us, any dentist, can use in the daily practice.
Yeah, and speaking about language, this digest that you have here physically is available online and is also available in 9 different languages. So that's a great service of the EAO.
Yeah, and we are happy because this way we can send our messages to all the dental community.
All across the globe. Now, your group, or you're part of the group that zoomed in on the biological aspects, right? So what was your key research question there?
Well, we were talking about 2 different topics. The first topic was the material of the abutment material, and the second aspect were perimplantitis definition and perimplantitis considerations. So one was more comparing titanium against other abutments, logically, and the other one was more based on what we need in terms of talking about perimplantitis. What the dental community needs to be talking all of us about the same topics.
Same thing. Let's zoom in, because the title of the digest is the key points for clinical practice. So let's highlight a few key points that dentists should take away from this.
Well, first of all, titanium is still the abutment material, the first choice for any implant reconstruction, because there are no differences, there are no statistical differences in terms of biological complications or even in terms of aesthetics. What we are at least in the articles that we were analyzing for our consensus report. But obviously, if we compare titanium with zirconia abutments, we find some differences in terms of plaque accumulation and in terms of bleeding on probing. So maybe this is something that we have to research in the future. This zirconia comparing to titanium will have an improvement in these aspects. But this is something that
That's something need to be researched.
Yeah,
what is the clinical implication of this for now?
For now, we still can use titanium abutment like the first choice, and zirconia abutment and aluminum abutments could be have an improvement in some biological parameters. And the last one, regarding in aesthetical parameters, in the articles we were analyzing, we couldn't find statistical differences between them. But there are another articles that we don't take in consideration for this consensus, that they do find differences between alumina and zirconia abutments and titanium. So in these articles, the soft tissue aspect is better with this alumina and zirconia abutments.
Materials. So key takeaway, titanium is still the standard. There's new materials coming to the market. You could start the experiment with it, but you should be aware you're in an innovative field and you should support anyone researching with that, right? Yeah.
That's
all right.
the key point.
Now, the other subject, the diagnostics, what were some of the key implications there?
Okay, I think the most important thing is that we were analyzing several articles, and in these articles we found like 15 articles with no periimplantitis definition in this, and also we find several different definitions. So for our community, the most important thing is that at least we need a fixed definition of what is periimplantitis.
Yeah.
And to have this definition is extremely important. It's compulsory to have a baseline, because with this baseline, we can check how is the evaluation of these marginal bone loss and other clinical parameters that are important for this diagnosis in periimplantitis.
And to be super clear, did you, in the consensus conference, identify that you need a common definition, or did you also make an attempt to define periimplantitis?
I think we put a highlight on the need to have a fixed definition for periimplantitis.
But it's not there yet.
It's not there yet, but there are some definitions that we are happy with, like, for example, Chappell and Sam's definition in 2012. But the important thing in the consensus digest is that we need, in the definition, we need to use several aspects: marginal bone loss, bleeding on probing, and probing death. Because if we use only one of these parameters alone, we cannot find this correlationship with the periimplantitis.
And it's difficult to compare cases and to learn from each other. Okay, so that's the key point in clinical practice. Always use these three parameters.
Yeah, the periimplantitis has to be a combination of different clinical and radiological parameters, and that we need to have a baseline, and this baseline has to be stated after the prosthesis installation, like several months after, because we expect to have some bone remodeling after the prosthesis reconstruction.
Exactly. Any other clinical implications that you want to highlight?
I think that to me, or for us, like a group, is that periimplantitis is an important issue, because we don't know which is the prevalence, because the problem with the prevalence is that if we don't have fixed definition, then the prevalence is going to vary a lot. But at least that is something that is important, and we have to look the periimplantitis in another way around, not in a implant level, better in a patient level, and these are the key points, and with several parameters.
Thank you. Alberto, thank you very much for sharing.
My pleasure to be
here.
And
thank you for watching. So you should be aware, there's a big piece of scientific knowledge out there from the consensus conferences. If you don't want to read the 300 pages, go on the EAO.org website. Yes, there it is. Thank you, Alberto. Go on the EAO.org website, check out the publications, and find the digest with all the key points for clinical practice that you should know about in the current state of the field.